Hello, good morning.
Hi. Good morning.
Hi, my name is Lucy. I'm a nurse practitioner student. I'm working
Hi.
together with Dr. Jensen. I'll be doing your history examinations today, okay?
Okay.
Alright. Let me just go and wash my hand and I'll be back.
Okay.
Okay, so let me ask you, how can we help you today?
I'm having a little trouble going to the bathroom lately. I've been having a constipation problem throughout the pregnancy, but last week I only passed through. I was able to pass through twice, and it's getting harder to pass it, and the stool is really hard. So, I really need some help in that department. So.
Do you have? Are you taking any medications?
Just my prenatal vitamin.
Okay. How is your drinking?
I don't usually drink very much. Usually it's maybe 3 glasses a day, so I don't feel very thirsty very often.
Do you have any nausea or vomiting?
No nausea.
No. Okay. Have you been trying to walk or exercise every day?
I try, but it hasn't been easy because all the weight gain I think I've gained throughout this pregnancy, so it's a little hard to walk.
Okay. So do you think you're gaining more weight for the past month?
Yes, for the past month.
Okay. Do you have any other symptoms that you already also experience? Like maybe back pain?
Yeah, I do have a little back pain.
Okay. How about any cramping?
No.
Any discharge of liquid, fluids, or blood? Okay. Let me ask you questions about your past medical history. Do you have any allergy?
No allergy.
Are you taking any vitamins, medications?
Yeah, just prenatal vitamins.
Any herbal or supplement?
No herbal.
Okay. Your immunizations. Do you already have your Tdap or flu shots?
Not this year.
Oh, okay. When was the last time you have your pap smear?
Last year.
Was it normal negative? Okay. And do you have also HPV done at that time?
Yes.
It was negative. Okay. Do you have any history of hospitalization?
Just during childbirth.
Okay.
First child.
Do you have any history of problem in the colon, like maybe like a frequent diarrhea?
No.
We call it irritable bowel syndrome. No. Diabetes.
No.
Do you have like a therapy maybe for your thyroid glands, like radiations?
No.
Have you ever been told that you lack of iodine?
No.
Throughout your pregnancy? No. Do you have any history of surgical history?
No surgical history.
No. Okay. How about the family history? Do you have a family with diabetes?
Diabetes, yes. On my mother's side.
Do you have any hypertension?
No hypertension.
How about thyroid disease?
Yes. And father's side.
From father's side. And who are your father's side?
Grandfather.
Grandfather. Okay. Do you have any history of kidney disease or lung disease?
No kidney.
No. Let's go over with your gynae history. Do you how old are you when you have your menses?
12 years old.
Okay. From one menses to another, what is the duration? 28 days. Okay. And then how long usually your period?
4 or 5.
Okay. Is it heavy or
moderate to heavy?
Moderate to heavy. Okay. And then is this your first pregnancy?
Second pregnancy.
Second pregnancy. And your doctor tell your last menstrual period was
October 31st.
Okay. And then your expectations of delivery is
August 7th.
August 7th. Okay. And your first child was delivered?
It was normal delivery.
Okay. And then how many weeks?
39 weeks.
39 weeks. Was it boy or girl?
It was a boy.
Okay. And the birth weight was
7 pounds 2 ounces.
2 ounces. Okay. Is there any complications throughout pregnancy or delivery? No. Okay. And then let me go over with your other social history. So are you married?
Yes.
Okay. So how long have you been married?
7 years.
Okay. So what do you do?
I'm a nurse.
Okay. Do you take any illicit drugs?
No.
Smoking? Alcohol? Okay. Is your husband your only partner? Do you have any history of a sexually transmitted disease in the past?
No.
Is how about your food intakes? So how often you eat your fruit and vegetables every day? How many servings?
Once a day.
One serving
of
a day.
Vegetable.
How about drinking water?
3 cups a day.
3 cups a day. Okay. So have you been exercising?
On and off. So we're just walking.
I'm just walking through here. Okay. So let's go over with your review of systems. Do you think that you told me you're gaining seems that you feel like you're gaining weight?
Right.
With that, do you also experience fatigue or weakness?
Yes.
Yeah. During the day, the night.
Mm-hmm.
Yeah. And then if you go over look into your skin, is there any dryness?
Yes, it's dry.
About your hair or anything?
Yeah, I
changes?
noticed some hair loss.
Okay. Now, you also experience any headache?
No.
No headache. How about vision? Is there any changes with your vision?
No.
Okay. For your do you have any like colds, obstruction or any nose bleeding in the past? Do you have any sore throat?
No.
Do you have any difficulty in swallowing?
No.
No. Do you feel like there's like enlargement in your thyroid gland right in front of your neck? No, you're not. Okay. Do you have any palpitations or heart murmur? No. Do you have any difficulty of breathing? Shortness of breath? No. Or kind of like wheezing or cough in the past? No. Do you have any heartburn?
Yes.
Yeah, heartburn. Okay. How about abdominal pain?
No.
No, you don't have any constipation. So you told me that you have better. Okay. Do you have any difficulty going to the bathroom, like peeing? No problem with peeing during that night. It should be okay. And then any swelling or joint pain or cramps in your muscles? No. Okay. Do you feel like do you have any problem with numbness?
No.
Numbness or tingling or anything like that in your extremities? Okay. Let's see. I'm going over to your vital signs. Your blood pressure today is 120 over 90, which is normal. However, in our record, we see that you gained 8 pounds for the past week, for the past month. So it's actually a really big jump for your weight, because we recommend you to gain weight during your pregnancy at least 1 pound a week. Okay, so that's another thing that you need to watch for. So now we're going to do our physical examination. So, I'm going to check on your eye, check on your eyes. Okay, open them up. Okay, there's no problems. Okay, check on your eye. You can swallow for me? Okay, that's good. Check on your eye. Okay. Take a deep breath. Okay, one more deep breath. Deep breath. Deep breath. Check on your skin. Check on your eyes. Okay, so I want to lay down. We gotta go check on your baby, okay? Do Do you already feel your baby kicking or moving?
Yes.
Okay, good. Okay, let's measure. Alright, 32. Okay, so you're 32 weeks too right now. I'm gonna listen to your baby's heartbeat. But before I listen to your baby heartbeat, is there any pain in your stomach? No? Do you feel any pain? No? Let's see. That's a baby heartbeat. And it's normal. Right. So, just listen here. Alright, looks good. Okay, really happy. Alright. So for my examinations, if you like it, what you're having right now is a constipations. Constipations is very common during pregnancy. That's just because the weight of the baby is pressing throughout the rectum, because the uterus is right behind the rectum, so it's pressing it, and so it's kind of hard to have the bowel movement. So the treatment for the constipations is to increase your fluid intakes. You told me you only drink 3 cups, so if you can increase to at least 8 to 10 cups a day, that will help a lot too. And then increasing your fiber in your diet, because 1 serving a day is not enough. You can increase it to 3 to 4 serving a day. That will help too. And then of course exercise. You increase your activities during the day. It helps with your bowel, with your colon activity, the exercises you do, so that it helps push those goals. Another thing that I is concerned about your conditions, since this is getting worse, is you might have the condition that we call it hypothyroidism. What is that? So hypothyroidism actually is a condition of the any abnormality that happen in your thyroid gland. This is common for women. It could also happen during pregnancy, and the cause usually is autoimmune. We call the disease as Hashimoto disease. So usually because of low thyroid hormone in your body's metabolism slows down. That's why you will experience a weight gain, and then constipation. Sometimes you may experience also insomnia, which you cannot sleep during the night, as your skin becomes dry, and then your some kind of loose of your hair, some cramps in your muscles, so that you might experience all those things too. So I'm going to do a test for that. We call it thyroid stimulating hormone, and then the thyroid hormone, which we call it 3T4. So if the results shows that you are having hypothyroidism, I will call you and inform you, and then I will refer you to our specialist endocrinologist, and they will be following up and monitoring you on that. Okay. Anything else that you need to watch since you're already on your third trimester? is important to watch for preterm labor. Okay, so you know what preterm labor is? When you're having like constant cramps, and then start to having pain, or you have a leak of water, or some kind of discharge, you have to come back to the hospital to have it checked. Because there's possibility that you're having preterm labor, before the time. It usually happen before 30 weeks gestations. 30 weeks pregnancy. So you need to watch on that. And then you need to watch too if you're also having, we call it pregnancy-induced hypertension. We'll be monitoring on that. That's what we're checking your vital signs every time you come. So far yours is normal. But if you're experiencing any blurry visions, any headache, edema on your legs or hands, then you need to let us know, because we need to do some tests to make sure you don't have preeclampsia. Yeah. And then any other questions that you may have? Let me see in the chart. Any other questions that you have? So again, I would like to see you come back in about 2 weeks. Okay. So if you already have results of the test, I will call you and then I'll let you know. Okay. All right.
Thank you.
Okay. Thank you so much.